This is our Hospitalized Child final project presentation over creating an outpatient oncology program. This presentation is done by Kimberly Centillion, Lindy Leemaster, and Anna Smith. Our overall objective is to establish an outpatient oncology program that utilizes services from a certified child life specialist to ensure that a child's time receiving treatment and services is as stress-free and comfortable as possible. Having a child life specialist on staff will assist children and their families emotionally, physically, and psychologically through their treatment, and this will allow our patients to adjust to their circumstances more fluidly and increase effective coping throughout their healing process. Our budget we have been allotted for this program is $70,000. We have allocated our funds to our child life salary, which will occupy 70% of our budget, then facility renovations, which will occupy 11% of our budget. Equipment and supplies will occupy 9% of our budget, and the last 10% of our budget will be allocated to miscellaneous. Once our program is fully established, we plan to present our findings to the hospital's Board of Trustees and present the benefits of having a child life specialist on staff in hopes of gaining additional funding. This is a pie chart of our budget for additional visual aid and seeing where and how we have allocated our funds. Our clinic would operate Monday through Fridays from 8 a.m. to 5 p.m. Due to our budget, we have only one child life specialist on staff, plus any volunteers and non-paid internship employees. The salary for our child life specialist would be $49,000 a year. When considering prospective employees, we look at their background and education and have a minimal requirement of a bachelor's degree, but higher education in a more specialized field will be more valued. A certified child life specialist credential is also a requirement, and preference will be made to those who have experience in the field of oncology and hematology with pediatric patients. When seeking additional staff, we look for a couple of characteristics. Some would be a passion for working with children and their family, great writing and verbal communication skills, working well with other staff members, managing emotional stress well, prioritizing tasks well, and having the ability to explain complex medical procedures to our patients. Child life specialists are very important to hospitals for various reasons. They provide advocacy for the patient, education for children about their diagnosis and treatment, teaching coping techniques, supporting children throughout their stay in the hospital, providing daily schedules and medicine taking, facilitating better communication throughout the hospital, and providing a less stress for families of our patients. From a corporate perspective, when both patients and families feel as if their voices are being heard and their needs are being met, this would be beneficial to the overall ratings and reviews of the hospital as a whole.
So for the toy inventory, we're utilizing some of the miscellaneous portion of our budget to fund this. The toys we select will help the child life specialist be able to ensure that the child feels comfortable in their environment and help facilitate effective healing and coping through play. Due to limited space and time restriction, we plan on heavily considering the functionality of toys when selecting them. And in order to prevent theft of these toys, we will have the hospital toys labeled, and for the more expensive items, such as an iPad, we will utilize a checkout system.
The toys we provided infants emphasize fine motor skills improvement. New skills can be made through toys such as the Fisher-Price Brilliant Basics Rock a Stack stacking toy that is pictured in the top right corner. Infants learn how to grasp the rings, stack the rings, and identify shapes. Toys we intend to provide toddlers with are more interactive and incorporate social referencing skills with adults and possibly other patients. The Play School Friends Mr. Potato Head Classic toy stimulates memory and applies previously learned information by taking off the limbs from the potato and placing them where they belong. Toys for preschoolers encourage pretend play and provide an opportunity for patients to interact with each other. The learning resources Pretend and Play Calculator Cash Register is very good for toddlers to learn about numbers, engage with peers, and be interactive. Toys for school-age children include arts and crafts to express creativity. The Step 2 Deluxe Master Desk with a chair is familiar to patients because a desk is something they are used to. These activities require extra thinking, stimulate conversation with peers, and give the patient freedom to take control of their hospitalization. The toys for teens are more mentally challenging and engaging for this age group. It helps them focus and learn strategies. The games enable patients to take control of their own hospitalization and allows them to be independent. The Rubik's Cube stimulates the brain and requires focus, distracting them from their treatment.
For our layout, we intend on having an open and comfortable layout in our clinic. We will provide privacy rooms in the back for patients and families to utilize when necessary, but the remaining space will be open and utilized in a group setting. For our color scheme, we are wanting to incorporate bright and colorful accents into our space. We found a study put on by World Health Design in which they did research that supports the theory of children enjoying spaces that are more colorful in a hospital setting. By implementing this color scheme, we are hoping that it has a positive impact on our patients' mood and their overall outlook on their health. So here's a visual representation of the layout that we are ideally wanting to implement. You can see how the majority of it is in an open area, but there are some spaces in the back that patients can use for privacy. So our goal for this program is to help ensure that every child in our program receives their healthcare needs in the most enjoyable, relaxed, and comfortable environment possible. In order to ensure we meet this goal, we have an open and inviting layout with private areas available if needed. We believe in our staff being prepared and dedicated to providing the best care to our patients. And even with our budget, we intend on being able to provide our patients with the sufficient amount of resources that they individually need. So in conclusion, we believe that our goal of effectively servicing this pediatric population dealing with oncology and hematology related illnesses will find comfort in our services provided by a child life specialist. And here are our sources for this project.